Hi, I'm Rachel Wall, founder of InspiredHygiene.com, and I want to share a resource with you today that has really meant a lot to me. This is a great little book that we all read here at Inspired Hygiene. We share it a lot with our clients. It is by Dan Sullivan, and it's called Learning How to Avoid the Gap. And the gap is a whole other conversation, but it's really kind of about, instead of looking at your ideal, right, of where you want your practice to be ideally, right? No mistakes ever, everybody shows up on time, everybody pays 100%, everyone says yes to treatment. You know, that's not realistic. It's good to have goals. We have to have goals that are a little bit of a stretch, but it's also important to always look back at how far you've come and see your progress today instead of always comparing yourself to an unrealistic ideal. So that's a very short version of this, and I would encourage you can get these on Amazon. It's called Learning How to Avoid the Gap. But there's a little piece I want to share with you here. It's a strategy that he says to how to increase your personal and organizational referability. And to Dan, referability is getting the best people to say the best things about you, right? Because that's what you want. That's how you get the best patients. And this is a little bit of internal marketing, okay? So he says in order to be referable, in order to get referrals from other people, there are 4 referability habits, okay? These are going to ring true with you. All right, so number 1, show up on time. Number 2, do what you say. Number 3, finish what you start. Number 4, say please and thank you. Very simple, but let's kind of look at how this applies in a dental practice. Show up on time. That's pretty obvious, right? Is doing our absolute very best to stay on time, start on time, stay on time with our patients on a day-to-day basis, okay? Do what you say. If you tell a patient, I'm going to call the specialist and discuss your case, and then I'm going to call you back in a couple days, do it, right? And if you can't personally do it, have someone else do that for you and create a system to make sure that it gets done, right? Whether it's a checklist of who did we say we were going to call, and then we're going to do it by what date, and then you have someone that's checking on that and helping you remember. Do what you say. Finish what you start, right? So this is kind of related here, is if we say, I'm going to work on this treatment plan and I'm going to finish this and get this back to you, then let's do it. Let's finish with what we start. This also includes doing treatment notes, right? So making sure before the end of the day that all of your treatment notes are finished and you've kind of wrapped up and put a bow on that appointment. And then the last one is so simple, but so powerful. Saying please and thank you. Thanking your patients for coming in. Saying thank you for team members that are helping you. When you need help, saying, would you please be so kind as to see this next patient for me, and just snap the bite wings. That would mean so much to me. Thank you so much. So please and thank you. So really simple, simple but not necessarily easy, but things to really increase your personal and your organizational, your practice, referability. Thank you.